Dr. Ed Zimmerman, Aesthetic Revolution, Las Vegas, welcoming you to another segment of Aesthetic Revolution, the podcast. I'm your host with my hostess, Staci Zimmerman, and today we're going to be talking about one of those topics below the belt that affects probably 5% or less of the male population, but has a real bent to it, so to speak, Peyronie's disease. So Peyronie's, it's not something you put on pizza, right? That's pepperoni.
Yes.
Okay, this is entirely unrelated. Sorry for the dad jokes, but it's that kind of day.
So the percentage is that low? Because we get a lot of men reaching out on this topic.
Yeah,
So,
well, they're throwing a real curve, pardon the pun.
so
Because,
actual Peyronie's,
yeah.
is there a certain degree to call it Peyronie's? And then is there a certain amount of curvature that's not Peyronie's? It's just the way God created you.
Good questions and a little more detailed answer. So Peyronie's, and it's interesting that it's called a disease because it's actually something generally induced by trauma. It can be an acute trauma to the shaft of the penis, like when someone's practicing reverse cowgirl and doesn't quite hit the mark, and the corpora cavernosa, the two parts of the hydraulics at 10 and 2 o'clock in the shaft of the penis, actually snap. One of them snaps, or one of them has a traumatic injury. And as it heals, scar tissue is formed. And so you've got a long shaft that fully fills with blood during the erectile process, and then another shaft that isn't able to fully fill with blood because of scar tissue. And it's foreshortened. And so the penis twists in the direction of the scar tissue, up, down, sideways, downways, however it is. Either way, there's scar tissue there. Now, in the active stage of Peyronie's, which can last 6, 12, even 18 months, as that scar tissue is continuing to form, it can cause pain, and it can cause increasing curvature of the penis, both at rest and with erection. So there's lots of things that can be done during that time. If there's no pain, and if the curvature is less than 30 degrees, so here's 90 degrees, here's 45 degrees, 30 degrees is about here. So you can have a reasonable amount of curvature that you may just be born with. Your parents may have gifted you that, and many couples find that useful. It can be a fun thing to have. So things don't always go down the straight and narrow, as they say.
It's true.
But, you know, a little curvature is okay. It doesn't hurt. It doesn't cause issues with erectile function. It doesn't cause issues with ability to procreate or have relations. Leave it alone.
I will say we do get a lot of women that comment when we're doing posts or videos on this subject, saying they love that.
Yep.
So I don't think it's at all an issue of will my partner be okay with it or I'm embarrassed about it. You know, partners seem to enjoy it. So
yeah, it can be very popular, particularly if the curvature is upward or the position used so the curvature is upward in the vaginal canal that stimulates the G-spot more directly.
Bonus.
Yeah, we won't do that particular dad joke, but yes, bonus. So anyway, Peyronie's can also be induced by chronic low-grade trauma. So some guys notice this with erectile dysfunction is they're trying to have penetration with a penis that isn't hard enough. And that causes undue trauma to one or both of the corpora cavernosa. Or it can be a series of manipulations. So guys who are trying to stretch the penis long, or guys who are excessively masturbating in one position or the other, or maybe they have help doing that, that can induce a low-grade plaque of scar tissue where one corpora cavernosa is foreshortened compared to the other.
Mm-hmm.
And voila, we have what's called Peyronie's. Sometimes, as we're doing exams in the office for the half penis procedure, you know, we'll find a little plaque, a little firm spot of scar tissue along the corpora cavernosa during our initial physical for the procedure. It hasn't caused the guy any issues. He may or may not be aware it's there. And again, if it ain't broke, don't fix it. So,
and if it does bother them cosmetically, what can you do?
So if there's a curve to the shaft, I'm going to get out my little prop here. Sir Richard Peter Johnson, one of our mascots. So say there's a little curve. Then in the course of the half penis procedure, where we put a filler in the potential space between the skin and the covering of the hydraulics, I can fill the inner curve a little bit more. That appears to make them look a little more straight. And I can fill the outer part here and at the base, so at the tip and at the base, sparing the middle part, and that makes him look wider and more straight. So we can play that game. It certainly hangs better when he's relaxed, and it tends to look a little better when he's erect. It doesn't do anything to length. And therein causes one of the issues with Peyronie's, because if you have a permanent tilt to your kilt, it decreases the apparent length by up to 1 centimeter. And some of the old-time cures can decrease the apparent length even more.
What do you mean?
Well, so in the bad old days, when you went to a urologic surgeon with scar tissue here, but maybe you're past the active stage of forming scar tissue, it doesn't hurt anymore. You're just complaining about the tilt. And there are a number of surgical procedures that have been done in the past and sometimes still are done. So certain things you can do. You can take the skin covering of the shaft of the penis and you can bring it down, okay? It's just like pulling down a sock. And don't do this at home, kids. You pull down that skin and all the filmy layers in between that we work so hard when we do our half penis procedure, and you expose the covering of the tunica albuginea. That's a thick fibrous covering that covers the hydraulics and everything in that hydraulic conduit. So you don't want to damage the tunica albuginea, but sometimes the tunica albuginea has some scar tissue that needs to either be cut out and then a graft put in place that hopefully won't cause more or even bigger scar tissue. Sometimes the scar tissue is scored that allows that tissue to extend a little bit if you put things in a splint, basically, while it's healing. No promises, because when you score something and Mother Nature fills in that tissue, it can just be a bigger piece of scar tissue, but it can be a little bit straighter. Now, if the scar or the plaque has gone down into the corpora cavernosa, the erectile tube itself, then you've got another issue, because you can't just score that. You may be able to melt it, and we'll talk about that next in the podcast. But you can score what's above that you can hope that Mother Nature will heal. But sometimes what they used to do is they would take the longer side, push down that skin covering, take the longer side, expose the tunica albuginea, and they would take this end and they would plicate. That means to pull together with sutures down to the degree below the curve on the other side, and they would straighten the penis out by foreshortening the repair side. So now you've got the plaque side that pulls things down. You've got the repair side that pulls things down. And you can lose 1, maybe even 2, but usually about 1 centimeter of length that way. They're not very popular to lose length,
Right.
but not the end of the world. Girth, as you know, is the more important thing, because that's what does most of the stimulation. But you can lose length with the old-fashioned surgical repair that pulls the penis back into straightness again. But sometimes you got to do that. Now, then you put the skin back up like pulling on a sock, let everything heal for about 8 weeks. During the healing process, there's many things that can be done to assist. Keeping the penis in some form of a splint, whether it's a material or an external device, may be beneficial. And there's all kinds of Rube Goldberg external devices that have been constructed. Some push against the body, and then they have a stretching device that kind of grabs onto the glands, the head of the penis, and kind of keeps it straight. Sometimes they use these devices without having surgery. So if you have a penis that has a warp to it, maybe the device comes to here, gives this base of the shaft support, the head part attaches, and then stretches things up gradually and stretches that plaque, that scar tissue out. And so it gradually is able to improve the curvature of the penis to a degree. Not necessarily recommended after the active part of scar formation has occurred, but can be done. Talk to your urologist about that, because this is an active moving target of treatments at this point, and the recommendations are changing a little bit. But what if somebody doesn't want to have surgery? I mean, who wants to have surgery down below? But some people do. There are other things, depending on the severity of the Peyronie's injury, that may be able to help straighten the penis and help dissolve that plaque if it's still painful. So as the scar is forming, just like a keloid or hypertrophic scarring, that thickening of the scarring can be very painful. It can be itchy. It can be all kinds of things. But typically, you feel the bulge, you feel the firmness under the skin, and it's something that you'll feel. Your partner may or may not be terribly aware of it unless it's causing an active curve that makes things uncomfortable during relations. There are things like collagenases. A collagenase helps dissolve tissue, helps dissolve collagen. So the generic term is a collagenase. The brand term of the one that's often used is Xiaflex. And this is an injection by your urologist, generally done under your insurance. It's not always successful. We've tried collagenases in hypertrophic scars and keloids with mixed results, quite frankly. But it does help some people. So it's worth a shot, pardon the pun. It's not a terribly painful thing for most guys. And you can actually numb the penis so you really don't feel the injection into that thicker, firmer, more tightly knit scar tissue. And that collagenase, done about once a month, and then helping splint the penis, putting it on stretch so it straightens out as the scar tissue relaxes a little bit, may be of benefit in a percentage of guys. There's also, typically we would use steroids. Somebody has hypertrophic healing, we would put a steroid injection. The steroid is an anti-inflammatory to calm the inflammation down so the body doesn't try to overheal. And that's been limited, but some success. In fact, you can even use sound waves or iontophoresis or some kind of pressure to push steroid through the skin, through the thinner skin over the shaft of the penis. And also you can use verapamil, which is a calcium channel blocker that's used in cardiac conditions. And you can push that through the tissue. That seems to have an effect on the plaque. So that's kind of interesting. Verapamil can also be injected, but generally it's not infrequently pushed through. Got to worry when you're pushing steroids through the skin, by the way, that you're going to cause thinning of the skin, vascular ingrowth into the area where the steroids are if you're using a high potency steroid, as you usually would. Steroids can also cause temporary or prolonged lipoatrophy. So depending on the age of the guy, there is a small amount of fat between the skin surrounding the penis and the tissues surrounding the hydraulics. So if that subcutaneous fat goes away, it can leave a defect, a divot, that the body may or may not fill in. So we've seen that occasionally when we've been doing our half penis procedure, and we have to contour that a little better on that side. But the skin changes usually go away over time, but it can take a year or two for the pigmentary changes and the thinness of the skin to resolve when left alone. So we've talked about surgeries to straighten him out. We've talked about injections to straighten out and dissolve the plaque. There are some newer technologies that have been used to straighten things out or to improve things that can be used concurrently with the other treatments for Peyronie's. One of them is platelet-rich plasma. When you have an injury, and say you get a little cut on your arm or anyplace else, that yellowish fluid that comes to the surface and then thickens up and forms a scab, if given the opportunity to dry up, that's your plasma. Plasma contains all of the activators and healing factors and things that draw on the white blood cells to scavenge away the dead tissue or the tissue that's having issues. And then it replaces, using growth factors and chemotactic factors and everything, new cells. It grows in new blood vessels, new nerve endings, things like that. And so platelet-rich plasma is something we use from forehead to feet in other parts of rejuvenation of the body. We certainly use a lot of it on the face. We may spray it under the flap when we do a facelift to help the tissue rebind. come back into contact with the underlying tissue and shrink wrap onto the face after we're doing a facelift. We use it as a little bit of a filler. We use it in areas to support fat grafting and fat transfers because it brings all the healing properties and tissue activators in. We use it down below the belt for things like O shots and P shots. So that's where we use a 5 to 7 times concentrated form of plasma, and we get platelet-rich plasma. So we've had other segments on that during our podcast. And so platelet-rich plasma can be used as a healing juice, if you will, to any place that has an injury. And certainly while the plaque is healing, we can try to get healing in a way that's more anatomically correct. So the scar may be stopped from becoming thicker, or after we've done surgery, we can get it to help heal in a more anatomical correct form so that the shaft remains more straight. It can help with pain, certainly when we put it in joints, shoulder joints, elbow joints, knee joints. PRP has been enormously helpful in causing normal healing and getting rid of pain. So we use platelet-rich plasma a lot in our treatments, especially rejuvenative medicine treatments. So PRP is something that can help. Another thing that can help break up the plaque is acoustic wave therapy. So sound pressure waves, and think of sound pressure waves as when somebody has a laugh or a squeal that breaks a crystal goblet across the room. That's a sound pressure wave that was in resonance with the atomic structure of the glass and causes it to shatter. Similarly, in medicine, we use particular acoustic pressure waves to shatter kidney stones without having to do surgery where we actually cut into the human, find the stone, or other ways we have of getting out kidney stones. So we can actually shatter those stones, turn a big boulder into smaller pebbles, into smaller sand along the way. We can do that to some degree with scar tissue. So acoustic wave therapy, called by a number of different names, may be valuable in helping break down the scar tissue. And we use it a lot during erectile dysfunction in order to help the corpora cavernosa regenerate, to knock the interstitial blockages of the vascular part of the corpora cavernosa back into solution and get carried away so that the corpora can engorge and open better during erection. What else? Those are the major things. I think that when we think of Peyronie's, we hear about it a lot. It doesn't happen as often in the population as one would think, but probably, 4 to 5% of guys in their lifetime may have an issue with this. The issue doesn't generally go away on its own, although small injuries can heal without any attention at all. But if you have a significant curve, especially associated with pain and a palpable button or lesion or plaque under the skin, that's worthy of going to see your doctor about and seeing whether you can get treatment, should get treatment, whether it's in the active formation form or you've kept this a secret for the past 6, 12, 18 months, and now you're going to your doctor because he's got a bent to him and you can't do anything about it, with or without pain. So there's lots of things you can do.
So definitely, if you have an injury, get to the doctor as soon as possible, because then possibly you can keep it from having the curvature. But if you do nothing, like a lot of guys do, nothing, then you've got that bend, and then it is harder to kind of treat it and bring it back to the right angle.
Yeah. So that's kind of the long and short, or the straight and narrow, of Peyronie's disease. It can cause contraction of the width, by the way, but that's something that we can treat more easily, and that's more cosmetic. So any scar tissue can contract the underlying tissue, and you can actually see an indent or even sort of an hourglass deformity if the Peyronie's plaque laps all the way, or most of the way around the circumference of the penis. So that's no fun either if you've got a squish. But we see it.
So with all of these gizmos out there that are stretching the penis, and we do still need to be careful with using even a penis pump too, or the jelqing, that you can cause some injury.
Yeah.
along the way. So using it the proper way is really important.
Yeah. Staci brought up a good point that I left out, is that vacuum pumps may actually be part of the treatment or cure for keeping the penis straight. So vacuum pumping after a repair or after an injury in order to sort of keep things straight, and then applying that splint, if you will, whether it's a wraparound splint. We prefer things that don't adhere to the skin, because that tender skin on the shaft of the penis gets ripped off really easily. So you want to use a non-stick dressing if you can, but still something that's going to keep the penis pretty straight and elongated during the healing phase. That would be a consideration. And remember, healing takes months. This is not something that happens overnight. Even though it may feel better, it takes months for the inflammatory part of healings to go away, usually 30 to 45 days, and go into the remodeling phase, which can take several months after that. So it can be a long process. So use your member carefully. And if you hurt him, make sure that you get attention.
And yeah, don't use them while you're getting attention.
Well, you can use him carefully, but you want to make sure that he has a full erection. And, we've had a discussion on erectile function and how to keep him fully at attention, not have him curved, not have him bent further and re-injure him during the healing process. So that's a little bit about Peyronie's disease. It might better be described as a Peyronie's injury or a Peyronie's syndrome. And some gentlemen do have a curve with some scar tissue from birth. It's just something that happened. There was trauma early on. So be careful with what you got. If you have an issue, get it looked at. Dr. Ed Zimmerman and Aesthetic Revolution, the podcast, talking about the long and short and the wide and curved and all the variable geometric issues that one can have with Peyronie's disease. So like, listen, look, share, all that kind of stuff. Send questions. We enjoy questions. And we'll see you on the next podcast, Aesthetic Revolution, the podcast. Thanks for listening.